But all of us as individuals, if we really come to terms with our real needs, no one would ever want to exist on Social Security alone. That's why we have pension plans. That's why we have defined contribution retirement plans and personal savings. Similarly, for retiree health, we don't want to count on Medicare by itself either. We're going to need the supplemental coverage. We're going to need those additional dollars and assets, hopefully in some tax-advantaged savings vehicles that would help us for our own out-of-pocket expenses, and they can be more significant than we ever thought about. So helping individuals understand it, helping them incorporate this into their overall retirement planning, helping advisors build this into their estimators and cost calculators for retirement income, and as individuals taking that responsibility, knowing that it has to be a shared responsibility. No one's going to do this for us. Our employer cannot do the whole job. The government's not going to do the whole job. It's really going to be an individual responsibility to work through our income needs and our health care security needs. So on that note, I will pass it on to my next presenter.
Well, thank you very much, Barbara. You certainly made my day, because reminding me that since I am married, that not indexed for inflation, but I can look forward to $20,000 per year. So I'm now $20,000 per year poorer than I was before I came in. But you know, I do think that one of the major issues for retirement security is the whole issue of health care coverage. It came home to me, my aunt and uncle, who are both in their mid-70s, and I never thought that I had to worry about them because my uncle had worked for his entire career in the cosmetic industry, had done well. But he had a major stroke in March of last year, and he's still in hospice. And so my aunt, not having ever done anything with any of the financials, asked me to help her out, and it was very interesting because they, you know, except for the stroke, I think they would have been okay. But now it's a lot less security. Fortunately, Barbara, they had purchased a long-term care policy from Unum. And I did, you know, my aunt was trying to figure out what she should pay, what she should. I said, well, make sure you keep paying that Unum premium, although but I also know the CEO of Unum. He and I worked together a long time, and Unum, who is one of the leaders, along with Genworth and a few others, in providing long-term care coverage, they've decided to get out of the business because it is so difficult as a provider to really understand how, from an actuarial perspective, how to price those policies. And I know my own right at both Aetna and ING, we never offered long-term care, Barbara, because we couldn't figure out how much we should charge for premiums. And we always thought there were two scenarios. One scenario was you charge for a per diem, and then that actuarially you can figure out what you should charge. But the problem from a legal perspective, and I know there's some lawyers or ex-lawyers in the room, we were always worried that, you know, 20 years from now, 30 years from now, the cost of nursing home care will probably be much higher than it is today. And we were worried that our per diems, you know, for a couple like my aunt and uncle paying, they're from, I think they bought the policy when they were late 50s. But they fund it, and then, you know, they end up needing it when they're mid-70s,